Good evening. My name is Dr. Libby Cope, and I'm the health officer for the Makah tribe, and this is the health officer update for February 16th. All right. So the situation in Nia Bay has not changed much. There's no new cases since November 23rd, and we're still in phase 3. However, earlier this evening, Makah Tribal Council approved a new health order 0221. This keeps the reservation in phase 3 and continues access to the reservation for enrolled Makahs and also access to the reservation for anyone with a vaccine appointment. What has changed is there is no longer a COVID testing requirement prior to accessing the reservation for those people who are eligible to visit the reservation. And those people are enrolled Makahs and their household members. So that was previously it said spouses and dependents, and it's now been expanded to household members. There will be more information shared on this health order tomorrow. I just need to give our staff a chance to put together some materials, but I wanted to get out the information now that the COVID test is no longer required and household members of off-reservation Makahs are able to access the reservation. Clallam County, as of 3:20 this afternoon, the percent positive has gone down to 1.6%, which means they're no longer high risk. They have 21 active cases and 0 hospitalizations. And this is where that information is from. This is just a graph showing the trend of cases in COVID in Clallam County. On Friday, February 12th, the state released its most recent Roadmap to Recovery report, and this report moved all regions except for the South Central region to phase 2. And this is Washington State's data. This slide is the projections from the Institute of Health Metrics and Epidemiology. It shows projections in daily deaths. And as you can see, the red line is what's been observed. So that's actual data, and the dash is the projections. And I brought this up last week because of this red line, which showed what would happen if people who got the vaccine returned to pre-COVID mobility. And what I wanted to show this week is the comparison of last week's projections with this week's projections. So I lined them up. The top one is February 8th. The bottom one is February 16th. And those lines are as close as I could get, but I wanted to show you that the projections have improved significantly. So this red line, I put right at 1,500 deaths per day. And as you can see, from last week to this week, even the worst case scenario has improved by over 1,000 deaths per day, which is hopeful for sure. We're continuing our COVID vaccine clinics at the community gym. They'll be tomorrow 9 to 4 by appointment, and we'll continue them on Wednesdays as needed. This is a repeater slide about the Moderna vaccine. For more information on the Moderna vaccine, you're welcome to check out our website. But in summary, it's 2 doses, 28 days apart. That's the minimum, the 4 weeks, and then maximum is 6 weeks between doses. The stick vaccine eligibility has not changed. We are currently vaccinating all tiers and certainly exploring options for expanding those tiers. But right now, those options haven't been expanded at this time. So as a reminder, please join the Makah EOC public briefings. I give presentations there every week, Tuesdays at 11:30. I also do presentations at the Coffee with the General Manager, which is every other Thursday at 10. If you have questions, please call the COVID-19 question and concern line. That number is at the bottom of the screen. It's 645-6273. All right, please take care and stay safe.